Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning or good evening, depends on your timing. Two questions to be answered in this short video. Question number one, what is epileptic syndrome and what is the most common example of epileptic syndrome? Question number two, what is the relationship between epileptic syndrome, epileptic encephalopathy, and developmental encephalopathy? To answer this question, let's not lose time and let's go. Before to start, I want you to remember two very important mnemonics. First mnemonic called STEEP. This mnemonic will help you not to forget any of the parameters needed to describe a specific seizure. The second mnemonic is called PLETO. This mnemonic actually will help you to remember the most important three medicines used to treat seizures occurring in neonatal period or during neonatal period. In order to label any patient as a case of epileptic syndrome, we need to answer 4 questions to confirm 4 points. Those 4 points, you remember them with mnemonic STEEP. The patient should have one or more of a specific S for seizure, T for type. So the first 2 letters from STEEP, the S and T for seizure type. Like, is it tonic, is it clonic, is it myoclonic, for example. Now, patient should have significant EEG changes that matches this epileptic syndrome. So next letter now is E. That's the third letter in STEEP. Third point, manifestation should start at a specific age group that is similar to other patients labeled with the same epileptic syndrome. Letter A for age group. And last point or last question that we need to answer is we should know the prognosis that matches this epileptic syndrome. So now STEEP stands for seizure type, EEG changes, specific age group, P for prognosis. To make it more clear, we'll take 3 examples from one age group. We have 3 famous epileptic syndromes occurring during first 28 days of life, all grouped under the name of neonatal epileptic syndromes. That means all of them will start at same age group or same age period, which is neonatal period, first 28 days. They will differ among each other in 3 parameters, which are seizure type, EEG changes, and prognosis. Considering prognosis, we'll categorize them into 2 categories, benign and non-benign prognosis. Actually, my aim in this video is to understand the principle of epileptic syndromes. So I will leave the seizure type and the EEG changes to another video. Now let's start discussing benign epileptic neonatal syndromes. I'm going to start now with the benign epileptic syndromes. There are 2. The names are benign neonatal seizures and benign familial neonatal convulsion. And notice here the word familial, and that will give you a clue, one of the difference between them. Actually, both are characterized by early remission, self-limiting, usually they disappear before 6 months of age, and having good prognosis. Both usually occur due to potassium voltage-gated channelopathy caused by genetic abnormality in gene KCNQ2 and KCNQ3, and both are treated by phenobarbital, levetiracetam, and topiramate. And here I'm just reminding you with the mnemonic PLETO, P for phenobarb, LE for levetiracetam, and TO for topiramate or topex. The only one which is not benign is called early infantile epileptic encephalopathy or Ohtahara syndrome, EIEE. This one, actually, it's the bad one. It's a bad guy because it's caused by brain malformation due to syntaxin binding protein 1 mutation, a poor course and poor prognosis, and it's not self-limiting. Why it's bad? Because actually it progresses to West syndrome, and if you remember, West syndrome needs steroid in the treatment. So this one as well, we should add steroid to treatment. So now, whenever you want to memorize any epileptic syndrome, just follow the mnemonic STEEP and compare each syndrome with other syndrome using STEEP and that will make things very easy for you. I would like to end this video by giving you 2 bonus terminology tricks, which they are very important. Before enumerating the tricks, it's important to know that in case of epileptic syndrome is confirmed, it is important actually to evaluate cognitive status as well as developmental status for the patient. Why? Now here's the first trick. In case of epileptic syndrome is associated with cognitive impairment, this will be called epileptic encephalopathy. It's a very important terminology. In case the epileptic syndrome is associated with cognitive impairment and developmental delay, this one will be called developmental encephalopathy.